Hello guys, this is how you do the Hendrich 2 Fall Risk Assessment. However, you're not going to call it that way because some of your residents, they don't know what that is. Call it the balance test. What you need are your assessment tool, your chair, and a lovely resident. Before you do the test, here are some tips. Tip number 1. Choose your candidate carefully. As much as possible, choose a candidate that does not use a walker. However, if they do use a walker, just make sure that they are steady enough for them to stand up and do the test. Tip number 2. Your chair. Choose your chair carefully. Is this a good chair? Nope. Is this a good chair? Nope. What about this? Is this a good chair? Perfect. Tip number 3. Explain the procedure to the patient. Apply all concepts that were learned back in class, including eye contact, eye level, talk slowly, clearly. You know what they are. The balance test. Here we go. Hi there. My name is Don.
Hi, Don.
Nice to meet you. What's your name?
Joan.
Joan. Nice to meet you, Joan. I'm a nursing student from Cypress College, and I'm going to be doing a balance test. Would that be okay?
Sure.
All right. Have a seat, and I'll
Okay.
explain to you what's going to happen.
Okay.
All right. Perfect. So, this is a balance test. It is composed of 2 parts. The first part, I'm just going to be asking you some questions.
Right.
And then the second part would be you're going to be standing up, walking 4 steps, and going back. But don't worry, I'm going to guide you
Walk
through
backwards?
it. Walk back.
Okay.
All right, I'm going to guide you through it afterwards, okay?
Okay.
All right, awesome. So, first question, I'm going to be testing your orientation, okay? So, can you please state your first and last name?
Joan Connolly.
Okay, and do you know what today is?
Yes, today's Tuesday, November 25th.
Correct. And do you know where you are? What is this place?
This is my apartment at Morningside.
Perfect. All right, so that is the orientation test. And now I'm going to be asking you about depression. For the past few days or weeks, have you felt depressed in any way?
Not at all.
Changes in appetite? No?
No, too
Okay.
good at appetite.
All right, that's
Food's
good.
good here.
All right, that's good. And then, what about elimination? I'm talking about urinating. Do you have any incontinence wherein you accidentally?
Not yet.
No, not yet. Okay. What about bowel movement? Do you have any
Okay.
problems with that? Good. And vertigo. I'm going to talk about vertigo. Dizziness.
No.
Do you feel any dizziness when you get up?
No, because I'm careful and I get up slowly.
Good. What about medications that, for example, blood pressure medication that can give you dizziness? Do you have anything like that?
Got the
Experience?
blood pressure medication.
Yeah, but it didn't
No
give you dizziness.
dizziness, no.
Good. Awesome. Alright, and another medication that I'm going to be asking you are anticonvulsant or anti-seizure medications. Do you take any?
No.
Anti-seizure medications? Good. What about benzodiazepines? These are anti-anxiety drugs. Do you take these kind of
No.
drugs? Alright, so those are the questions part. Okay, we're done with that. And now we're gonna go do the get up and go. This is
Okay.
you standing up, and you actually have 3 options.
Yeah.
You can actually put your your hands over here
Okay.
on your lap or on the side of the chair, whichever you're comfortable with.
Okay.
And you can just go ahead and stand up whenever you're ready.
Okay.
Perfect. Good. Do you feel any dizziness whatsoever?
No,
No. Good. We're still good?
we're still good.
Alright, awesome. And then I want you to step forward 4 steps at a time. Good.
One.
And that's it. And then let's go
Back.
back. No. Not go back. You turn around.
Oh, turn around.
Turn around.
Okay.
And then go back to the seat.
Okay.
And then have a seat.
Okay.
And then there. How did that feel? Was that okay?
That was perfect.
Any dizziness whatsoever?
No.
Good. Alright, so I'm gonna give you the scores in a bit. I'm gonna explain to you how we're scoring this. So for orientation, I gave you a 0.
Oh, 0.
Well, 0 is a good. 0
Oh,
is good.
I see. Oh,
the
okay.
higher the point is,
Okay.
the worse
okay.
it gets. So a 0 is okay because if you would have been disoriented, I would have given you a 4. Because
Okay.
patients, residents who are disoriented, they tend to fall a lot. So they have a risk point. We call this the risk point. So you get a 0.
Okay,
Okay,
good.
which that is good. All right. And then for depression, I gave you a 0 because you
Good.
don't have any depression. If you would have had depression or any eating problems, then I would have given you a 2 point. All right. Elimination and dizziness, I gave you 0s on those because you don't have any dizziness problem.
No?
Yes. And here, this is actually criteria male. If you would have been a male, I would have given you an automatic 1 point. And I think this is kind of like gender bias, but it's part of the assessment tool because males tend to not ask for help when they get up. Females, they found out that they ask help. They have hard time getting up. They ask for help. But if you're a male,
That's really interesting.
right? So if you would have been a male, that would have been an automatic 1 point. But since you're a female, so I give you a 0.
Okay.
That's very
That's
interesting.
good.
All right. And then for the anticonvulsants and benzodiazepines, you don't take any medications, so I gave you 0s. Those medications, if you take them, they tend to give you orthostatic hypotension. The same thing with blood pressure medications, or it can have a sedation effect. It can make you drowsy, it can make you sleepy, so risk for fall, right?
Okay.
All right, and then since you got up, 1 attempt without any pushing yourself, I gave you a 0 because you didn't lose your
Okay,
balance. Everything
great.
was okay. So you have a total score of 0, which is okay.
Okay,
That is a
that's
perfect
good.
score.
Okay, that's great.
Usually a score of 5 or above is a greater risk for fall. So what we do is we provide interventions to prevent falls. But again, even though you have a 0, that does not mean that you're free from falling. There's always this risk.
Oh, sure.
So yeah, it is very good that you told me that you're careful, and we always encourage that to all our residents.
Sure.
Sure. Okay. That's it. And that's the get up and go. That's the balance. If you have any questions for me,
No, but I do go to balance class, and that helps.
that helps a lot. Yeah,
Right.
and then we encourage our residents to take those classes because it will help in their balance.
Oh, sure. Even,
All right.
Even the exercises are
Good, good, good. Well, thank you. Thank you for your cooperation. Thank
Thank
you so
you,
much.
John.
I really appreciate it. That was the balance test. I hope that was beneficial to all of you. And in behalf of all 294 students of fall 2014, we wish you good luck and have fun. Now, come on. I want you to say stop.
Okay.
Say stop, say stop.
Stop.
Right here? Okay,
Yeah.
get the card.
Yeah.
Show it to everybody.
See it?
Alright, so what I'm gonna do, oh, well, it's okay if I see it. It's a 10 of hearts. So this is, okay, don't, see? I have here the 10 of hearts. Okay?
Yeah.
Alright, I'm gonna put it here. Can you hold this for me?
Sure.
Alright, so see, watch this. 1, 2. Hang on, watch this. 1, 2. Oh, you know what? I think this is not the top of the card.
Don't tell me.
Wow.
There's only one 10
You're
hearts.
in the wrong field.